Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
Pre-operative assessment of the cataract surgery, we do have some crucial and important tests. I'll just tell you two important eye tests that need to be done. There could be about 4 or 5 tests cumulatively which may need to be done based on the specific case and specific situation of the patient. But universally speaking, there are 2 tests which are almost mandatory. The most crucial among them being something we call A-scan. A-scan does the measurement of the curvature of the eye and the length of the eyeball. And this scan is especially helpful to us to obtain the correct reading of the intraocular lens that we need to implant into the eye. The more accurate the reading we get out of this A-scan, the lesser will be your dependence on the glasses post-cataract surgery. So you can assume and imagine how important this scan is. The second scan that we do is something called as OCT macula. This is primarily to check out and see if the most crucial part of the nerve of the eye is healthy or not. So retina is the nerve layer, and in retina the most sensitive zone is called macula, and this is exact spot is where we do the scan and find out its health. In addition to these 2 very important and mandatory tests, we also sometimes may need to do something called specular microscopy, where we do a count of important cells in the eye called as endothelial cells, which determine the health of cornea. We might need to do something called as corneal topography in specific situations where patients have high astigmatism or doubt about some conditions like keratoconus, or we are not getting the curvature of the eye properly in the regular scans. These are among the common tests we do as far as eye is concerned, and in addition, we will also need some basic blood examination like blood sugars, blood pressures, blood counts, etc., and then ECG as well. Some of the doctors may insist on getting a physician clearance as well, which could be very important. So these are what you need to expect in the pre-operative assessment. As far as specific preparations are required, nothing much. Quite a lot of doctors, ophthalmologists may advise you to start on pre-operative antibiotics based on personal preferences of the doctor, anything between 1 day to 3 days prior to the surgery. And then in addition to that, some specific medications, if the conditions require, like glaucoma, the doctor may put you on anti-glaucoma medications beforehand, if at all required, which will be assessed by the doctor. These are what will involve the pre-operative assessments. The whole pre-operative assessment, excluding the physician clearance, the eye-related test should take approximately about an hour or 2 or so. So the blood tests take about 30-40 minutes or 1 hour. So overall, you could see about, say, 2-3 hours of pre-operative assessment.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
Fortunately for us, cataract surgery is one of the safest surgeries that we could do on the human body. And as everybody knows, the results are extremely gratifying. Happily, the amount of post-operative care that we advise now and the patients have to undertake is so less compared to, say, for example, 20 years or 30 years back. Just as an anecdote, my father got operated when I was a medical student about 30 years back, and he was admitted for 3 days in the hospital, and I had to tend to him with breakfast, lunch and dinner in the hospital while he was admitted. today we do a cataract surgery and the patient needs to be in the hospital just for maybe about a couple of hours or so. And he has his breakfast and then comes in, walks into the hospital, and then just walks off and reaches his home for lunch. Usually most of the doctors would insist upon one important thing, whereby they may ask you to desist from splashing water into the eye for a period of anything between 1 to 2 weeks. This would be probably the single most important precaution that you might need to take. This also means that you can't have head bath, because if you have head bath, the water might trickle down to the eyes. Apart from that, most of the other work you could just start in a day or two. So when I say most of the work, this includes reading, writing, watching movies, mobile, going to a cinema theater also can be done just in a few days, and travel is not a restriction as long as you just put some protective eyewear wherever dust or dirt is anticipated, or wind, there is a high wind velocity area. So as you see, I gave you a very, very short list of the preoperative precautions that you need to take, and that is how it actually is. The modern cataract surgery gives you that huge amount of freedom, and gives you that ability to do a lot more tasks and get back to your work much, much faster than you would normally do. Even people who are on computer jobs or most of the other jobs which doesn't involve outdoor, they should be able to get back to their job just within 2 to 4 days.
Sure.
I would recommend that they take the advice of the doctor in specific situations, because when I'm telling you these recommendations, I am telling in general, which is applicable to most of the patients. But however, if there are any specific recommendations or precautions required, your ophthalmologist will tell you.
Agreed, doctor, what you said. Are there any common complications after cataract surgery, and how they can be managed or prevented?
Following cataract surgery, of course, see, surgery is a surgery, and just like every task is involved with a risk, so are the surgeries. I keep telling my patients, even when you walk down the street, it's fraught with risks. When you travel to your workplace, you might meet with an accident. So if you expect that all the surgeries are going to be 100% safe and without complications, there can be nothing far from the truth. But again, having said that, also remember that cataract surgery still continues to be one of the safest surgeries that a person can undergo. And again, despite that, of course, in some unusual situations, there could be complications which could happen. Among the common complications which could happen is something called as a PC rent, where we have a support system. When we remove the cataract, we place artificial intraocular lens as a replacement. As you can understand, this new intraocular lens that we place into the eye needs an anchor or a support. In some people, this anchor or support may not be strong enough to hold the lens, in which case we may have to change the type of the lens. So this could also lead to some leak of a fluid called as vitreous, which is at the back of the eye cavity, in which case we may have to do a shaving of this leaked fluid, which is called as vitrectomy. This happens to be one of the common things. Fortunately, a lot of other complications like a zonular weakness, where the support is weak, many a times we manage it by adding some rings and additional support system, and then take care of it. There could be sometimes loss of something we call endothelial cells, which could impact recovery of the eye, the corneal swelling for quite a long time, and the vision may take some time to heal. A lot of times this can be detected before the surgery, and then usually we keep the patient informed about it. But there could be some situations where this could come to us as a surprise. Infections, which is called endophthalmitis in our ophthalmic language, fortunately nowadays has become more and more rare, and not definitely in the frequency that we used to see 2 to 3 decades ago. So we do still face endophthalmitis, but the rate of these infections are something like 1 in 5,000. which are extremely rare nowadays. So I have just touched upon one important complication, which is infection, which is very rare, and some common 2-3 complications. Though there could be a very long list of complications, since these are not so common, I thought I'll just let you know about the common ones. If you still want to know, usually consent form is given to you before the surgery, before you get operated, which are required to put your signature. The consent form that you sign prior to the surgery will have an exhaustive list of all the complications that are possible. Here you need to remember, if you're especially prone for any complication, many a times the doctor should be able to tell you, or else if you have any doubt on any of the points listed in the consent form, you might discuss it with your ophthalmologist.
So doctor, your expertise and insights on cataract surgery pre and post-operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.